Is there a cure for narcissism? It's a provocative question, isn't it? But it's one that deserves exploration. Narcissism, a personality trait marked by an inflated sense of self-importance and a lack of empathy, is often misunderstood. The significance of finding a cure lies not only in aiding those directly affected, but also in promoting healthier relationships and societal interactions. So do we have a cure, or are we yet to discover it? Let's dive deep into this intriguing topic and see what we can uncover. Before we delve into potential cures, treatments, and therapies, we need to understand what narcissism is. Narcissism in the realm of psychology is more than just vanity or self-love. It's a complex personality disorder marked by an inflated sense of self-importance, a deep need for excessive attention and admiration, and a lack of empathy for others. Imagine a person who constantly seeks the limelight, is hypersensitive to criticism, and tends to exaggerate their achievements. These are classic symptoms of narcissism, but it's essential to remember that everyone can display these traits to some degree. What sets a narcissistic personality disorder apart is the intensity, duration, and the distress it causes. So, what causes narcissism? There's no definitive answer, as it's likely a combination of genetic, environmental, and neurological factors. Some theories suggest it could stem from early life experiences, such as excessive pampering or conversely harsh criticism. Others propose it's linked to certain genetic and neurological conditions. Now let's talk about the effects of narcissism. It's like a double-edged sword. On one side, narcissists may appear confident and assertive, which can make them successful in certain areas of life. However, on the flip side, their lack of empathy, manipulative tendencies, and constant need for validation can damage relationships and cause significant distress to themselves and those around them. It's crucial to distinguish between healthy self-esteem and pathological narcissism. Healthy self-esteem is a balanced appreciation of oneself, acknowledging both strengths and weaknesses. In contrast, narcissism is a distorted self-image where one's perceived worth is inflated, and flaws are either ignored or projected onto others. Understanding this distinction is key because it helps us recognize when self-love crosses over into the realm of disorder, requiring intervention. It's not about demonizing self-confidence, but about recognizing when it becomes destructive and harmful. Now that we have a grasp on what narcissism is, let's move on to explore potential cures and treatments. You may be wondering, are there medications that can treat narcissism? The answer is not as straightforward as you might think. In the realm of mental health, it's important to understand that each condition is unique and requires its own specific approach. Narcissism, being a personality disorder, is no different. There isn't a magic pill that can cure narcissism, but there are medications that can help manage its symptoms. Let's dive a bit deeper. Narcissism is a complex personality disorder characterized by an inflated sense of self-importance, a deep need for excessive attention and admiration, and a lack of empathy for others. People with narcissistic personality disorder often suffer from associated conditions such as depression, anxiety, and other mood disorders. This is where medication comes into the picture. While there's no specific drug that targets narcissism directly, certain medications can help in managing these associated conditions. For instance, antidepressants or anti-anxiety medicines can alleviate some of the emotional distress that a person with narcissism might experience. These medications can help stabilize mood swings and reduce feelings of depression or anxiety, which are often linked with narcissistic personality disorder. Moreover, if a person with narcissism is also exhibiting symptoms of other mental health conditions like bipolar disorder, certain mood stabilizers or antipsychotic medications might be recommended by their healthcare provider. However, it's crucial to remember that medication is not a cure-all. It's a tool, a part of a broader treatment plan that often includes psychotherapy. The goal is not to eliminate narcissism, but to help individuals manage their symptoms, improve their relationships, and lead healthier, more fulfilling lives. While medications can be beneficial, they are not without side effects. It's essential for individuals and their healthcare providers to weigh the benefits against the potential risks before deciding on a treatment plan. In conclusion, while there is no specific medication to treat narcissism, certain drugs can help manage its associated symptoms. However, medication should be viewed as a part of a comprehensive treatment approach rather than a standalone solution. While medications can help manage some symptoms, they are not a standalone cure. This leads us to the role of therapy. Therapy plays a crucial role in managing and treating narcissism. Let's examine some of the therapeutic approaches used. To start, we have cognitive behavioral therapy, or CBT for short. This approach is a widely used therapy method that deals with problems by changing the way you think and behave. In the context of narcissism, CBT helps individuals recognize harmful patterns of thought and behavior. The goal is to replace these with healthier, more positive alternatives. For instance, someone with narcissistic tendencies might believe they are superior to others. CBT would challenge this belief, encouraging the individual to see themselves as equal to others, not above or below. Through repeated sessions, this can help reduce feelings of entitlement and superiority, common characteristics of narcissism. Next, we have schema therapy. This approach is a bit more specialized, focusing on identifying and changing deep-seated patterns or schemas that shape how we perceive ourselves and the world around us. For a person with narcissistic tendencies, these schemas often revolve around superiority, entitlement, and a lack of empathy. Schema therapy can help individuals recognize these destructive schemas and work towards healthier ways of thinking and interpreting the world. It's a more intensive therapy that often requires a longer commitment, but it can be particularly effective for people with deeply ingrained narcissistic behaviors. And then there's psychodynamic therapy. This approach dives into the unconscious mind to uncover and understand the roots of psychological issues. For narcissism, this could mean exploring past traumas, childhood experiences, or deeply ingrained beliefs that contribute to narcissistic behaviors. The goal is to bring these unconscious factors to light, understand how they influence current behavior, and work to change these influences over time. Psychodynamic therapy can be a lengthy process, but it offers a deep, comprehensive approach to understanding and treating narcissism. Now, it's important to remember that therapy is not a one-size-fits-all solution. What works for one person may not work for another, and it often takes trial and error to find the right approach. Additionally, the effectiveness of therapy largely depends on the individual's willingness to change. Remember, narcissism is characterized by a deep-seated belief of superiority and entitlement. Challenging and changing these beliefs is no easy task and requires a genuine desire to change. Moreover, therapy is not a quick fix. It requires time, patience, and persistence. But with the right approach and a dedicated effort, therapy can help manage narcissistic behaviors and improve overall quality of life. In conclusion, therapy can be a powerful tool in managing narcissism, but it's not a magic cure-all. The person must be willing to change. As we've seen, treating narcissism is a complex process that involves a combination of medication and therapy. This isn't a condition that can be silenced with a magic pill, nor is it something that can be resolved with a quick chat. It requires a comprehensive, multifaceted approach, one that is tailored to the unique needs and circumstances of each individual. We've delved into an array of potential treatments and therapies, each with its own set of advantages and challenges. Medications, for instance, can help manage some of the symptoms associated with narcissism, such as anxiety or depression. However, they don't tackle the root cause of the condition, and they are not a standalone solution. On the other hand, we've explored different forms of therapy, from cognitive behavioral therapy to schema therapy and dialectical behavior therapy. These approaches aim to help individuals with narcissism develop a healthier sense of self, foster empathy, and build healthier relationships. But therapy is not an overnight solution. It requires time, patience, and most importantly, a willingness to change. This brings us to a crucial point: the importance of an individual's willingness to change. Because narcissism is deeply ingrained in a person's sense of self, it can be challenging for them to recognize their behavior as problematic, let alone seek help. And even when they do, progress can be slow and fraught with setbacks. But it's important to remember that change is possible. It may not be easy and it may not be quick, but with the right help and determination, it can be achieved. In conclusion, treating narcissism is a journey that involves navigating a complex terrain of medications, therapies, and most importantly, personal growth. It's a journey that calls for understanding, patience, and perseverance, both from the individual with narcissism and the people who support them. While there is no simple cure for narcissism, there are ways to manage it, and with the right help and determination, anyone can make progress. It might be a long road, but it's a road that leads to a healthier, more empathetic, and fulfilling life. And isn't that a journey worth embarking on?